And this is where I'd like to stop for a moment and talk a little bit about palliative care and advanced care planning for patients. And I know that some of you on the call have just heard me say palliative care, and you're thinking she's talking about end of life. I wasn't talking about end of life. I'm talking about my patients who just have a chronic condition. Well, palliative care is not limited to end of life care. The definition of palliative care is managing the burden of disease. There's nothing in the definition that implies that this is only for persons who are at their end of life or at risk of dying imminently. And similarly, advanced care planning by definition is something we could all benefit from. All adults should have an advanced care plan. It should be revisited throughout their lifetime, and it will be a way to give care teams and family members some sense of what this patient is expecting in terms of their care, what they know about their disease, and where they would like their trajectory to take them. Many persons are not interested in having every single intervention under the sun, and very often once a patient is hospitalized, we immediately begin with testing and with interventions because we make an assumption that that is what the person wants. Advanced care plans can be very valuable in understanding the degree of intervention that someone is comfortable with and their understanding of their disease and the likelihood of what they will bounce back to with an intervention. So many of us are aware of the fact that CPR has a much better outcome on television than it does in real life in a hospital, and having a conversation with a family and with a patient about what their realistic expectations are is something that goes on far too frequently. So the goal of care for all of our patients is quality of care, not quantity of care, and palliative care and advanced care planning can really help us look at that difference between quality and quantity of care. Next slide. And there have been a number of studies that have shown that of patients who are in hospitals that have participated at their own request or the suggestion of their providers in palliative care programs, we've been able to show a decrease in both direct and indirect costs for those patients because there's a better alignment of the care that the patient is seeking and the interventions that the providers are providing to them. Next. But in order for next slide. But in order for palliative care to be successful, conversations are required. And unfortunately, conversations in advanced care planning are not occurring regularly. Even though when you ask the man on the street or the woman on the street whether or not they think it's important to talk about their wishes for care, particularly end-of-life care, but in general, 90% of them think that it's important and only 30% of them have had that discussion. And a conversation is not something that can take place in just 3 to 5 minutes. There is, sometimes the opportunity to provide some significant input to a patient about what their disease is all about and what the trajectory of their disease might be. Particularly important for frequent flyers, for congestive heart failure, or for COPD, or renal failure, where they absolutely have no idea that there is a trajectory for their disease, and yet no one has shared that with them. And so they are just grasping at whatever opportunity is given to them for a cure, not understanding that maybe they would want a care opportunity versus a cure opportunity. So the consequences of not talking about it certainly relate to the quality of care that patients receive and the imbalance between what they wanted and what they received, but it also has a significant cost implication. And we often don't think about the cost implication because for patients on Medicare and Medicaid, the assumption is that somebody else is picking up the bill and there isn't really a cost to the patient or family themselves. But we know that more and more that's not true. There's a huge patient and caregiver burden for too much care, not just emotional and physical, but there's a financial burden. With so many of the procedures being moved to the outpatient setting or observation status within hospitals, those bills are now being shared more and more with patients and families. So if they're not aware or they're not involved in making those choices, and then later down the road they receive a bill, that can be a huge burden for some of these families, and it may have them question what they do the next time. And the unfortunate part about that is they might have wanted to forego this previous hospitalization in favor of one that provided them with a return, but not having had that conversation, they're not aware of those choices.